Do you suffer from an overactive bladder? Are you dealing with an interstitial cystitis condition and or an incontinence condition that is just causing you terrible suffering where you can't get over these symptoms no matter what medical practice you've had done and what medications and what exams have been performed for you? My name is Dr. Herman. I'm with two lovely a couple, Mrs. Sharon Mathis. She is a patient of mine, and her husband, Mr. Larry Mathis. Thank you. She's a patient of mine now. This is January 22nd of 2019, and she started coming to me. It was May of 2018. Mm-hmm. Your bladder control condition. How severe was your bladder control condition? How urgent and frequent was it for you before you started with me? How many times in 24 hours would you have to go to the bathroom?
I'd say 40, the low 40s, mid 40s.
Low to mid 40s, yeah. So that's 24 hours, and that was every day.
Mm-hmm.
And how many years ago did your bladder control problem start?
It's been about 8 years ago.
8 years ago.
Mm-hmm.
And as you were telling me, you were abroad and across on the other side of the world, and it started. Mm-hmm. And what kind of doctors did you go to over the 8 years before you came to me? What kind of doctors did you go to? And we're reporting right now you're having great recovery. You're having great improvement in the symptoms.
Yes.
So we'll get into that in just a few minutes,
mm-hmm.
okay? What kind of doctors did you go to before you came to me?
I was under urologists all those years,
Mm-hmm.
for that 8 years.
Was it one urologist or multiple different ones?
I went to three, didn't I? Three different ones.
Were there
mm-hmm.
hospital visits as well, emergency room visits, anything like that?
Not during that time, but...
Not for the bladder control
mm-hmm.
problem?
Yeah.
Okay, and were there other doctors? Did you ever see like a kidney doctor? Was there any internist, anybody else?
No.
Okay, and what kind of procedures did these urologists do on you?
Okay.
To try to figure it out
mm-hmm.
and help you?
They did the bladder extension, and then I took bladder treatments. They would fill the bladder up with 5 different medicines, some antibiotics, and I did that.
All at the same time or over a period of time?
Over a period of time. They did 5 in the bladder each time, once a week for a year. I went solid.
A year. Every week for
mm-hmm.
a year. Was it injected or they were actually putting something inside you?
They put it inside me.
How'd they get
with
that?
A catheter.
A catheter.
Mm-hmm.
Wow. And so every week.
Mm-hmm.
How long
once
was the office visit for that you had to go there once a week? How long were you staying in there for? Was it a few minutes?
Just a few minutes. Just
walk in.
Yeah.
Gotcha. And
mm-hmm.
were there any positive changes with that kind of therapy?
At first it helped, and it would help, after a day or two. And then it got where it wasn't helping to be half the week gone before I was out of the pain. It caused some pain. So it got to where it wasn't helping at all.
And what was your next suggestion?
Well, they really wanted, the last time I went to one, they wanted me to do it again, but I wouldn't.
But there were some other things?
I had it that solid year, but then I had it like for 6 months another time, and then I'd have it, one time I had it like for 6 weeks. But
6 weeks what?
At first they had me do it like 6 weeks, once a week.
Gotcha.
And then I did it like 6 months, once a week, and then we moved. This was in separate times, and then we moved, and I did it for a year. I thought it
probably
seemed...
did it a year and a half all total.
Mm-hmm.
Suffered terribly with it. And,
yeah.
And they ran tests. They checked for gallstones, kidney stones. They did MRIs, all kinds of tests. It always came back wanting to do this same procedure over and over, and they gave her medications by the mouth, pills to take to try to ease it.
What kind of pills do you remember the names?
Ustel is one of them, USTELL.
Did that make any difference for you?
It helps a little bit. It just soothes the pain in there. It doesn't really
But
heal
the
it.
urgency and the frequency, was that ever reduced at all with that medication?
A little, but it got to where it didn't help
It
either.
progressively got worse.
Just got worse, even with the meds. So even if it helped a little bit for a little while.
And they usually put me on antibiotics too for a while.
Mm-hmm. You were telling me, Mr. Mathis, you were saying that there was a procedure that they did to inflate inside and something happened to the lining of the bladder?
What they did is they said they needed to look inside the bladder. So we had to schedule a procedure where they did that. And they after the procedure, when we had the consultation, they said that the inside of the bladder lining was just red, raw. And
this is, I'm sorry to interrupt, this is after already having these antibiotics put in through the catheter?
No, that was before.
So this brought them to the stage of doing the antibiotics.
So what they wanted to do was to expand the bladder. They filled the bladder with some sort of solution, whatever they did. They expanded the bladder as far as they could.
They stretched it.
Stretched
Yeah.
it so that the lining would come out. That's what they explained to us. Now, they said it in non-technical terms, layman's terms, that the bladder would actually come out.
That the lining
The
of the bladder
lining.
would come out, not the
Yeah,
bladder would
yeah.
come out.
The lining of the bladder would come out, and obviously would grow a new lining. They thought that would get rid of the infection.
So they did the procedure and that didn't.
Didn't help, and then they wanted to do it again, and she refused.
They're wanting to do it now, but I haven't. I've
do you
refused
mean
it,
now?
and they almost insist.
What does now mean? When was now?
Um,
You're not still seeing them since
It's
you
been-
with me.
it's before that.
Okay, so now it's like you're talking about a year ago.
Yeah.
Yeah.
All right. See, you're not cheating on me.
No,
I'm kidding.
not
I'm just
cheating.
kidding. I'm kidding. I'm kidding. And she's laughing. Look at that. You have no idea. I wish I would have taken a video of her, and her husband will tell you, and she might tell you right now, because this smile was not part of her first presentation,
No.
right?
Not at all.
Not at all.
Not at all.
There was terrible suffering. With your urgency and frequency of 40 to 45 times in a 24-hour period, were you able to sleep at night, through the night, with this bladder control problem?
No, I didn't get any sleep.
How many times were you up at night before? Before you came to
Well,
me?
Sometimes 10, I'd say 10, 12,
You would
It's
be
different
up. She
times.
would be
8 to 10 times a night.
sometimes 2 to 3 times an hour.
2 to 3 times in an hour. And you'd be up as well.
Right.
You couldn't sleep with her
Right.
getting up and
Mhm.
torture with. Did you always, when you went to the bathroom, did anything come out? Always? I mean, every trip to the bathroom, was there always urine coming out, or was it sometimes nothing coming out?
Well,
Even
most
though
of
you
the
felt
time,
like you had to go.
yeah. Sometimes I felt like I had to go and I didn't, but most of the time a little would come out anyway. But
But sometimes nothing came out.
Mhm.
Sometimes. Okay. And you were, well, just let something out of, you had breast cancer,
yes,
that was, and you had to go, you went through chemo and the radiation and the surgery, and then things just progressively got worse with the bladder control problem after that.
hmm
Right now, we are after your third protocol with me, third very unique protocol.
Mhm.
Pretty easy to take it home.
it's
Yeah.
real easy.
Okay. Are your friends kind of like skeptical, saying, what is this that she's doing with these drops?
Some,
But right now, they see you as,
yeah,
little
my
better?
family, they weren't skeptical. They just wanted me to get help, and they can see the difference, and they tell me,
now they see.
yeah.
The family
They're real
has been
encouraging.
very supportive.
Some friends are skeptical, and
They're skeptical. Oh, they're skeptical now because they see your smile. Do they see your smile now?
well, I
They
don't
were
know.
skeptical in the beginning.
Yeah,
But are they now
That's kind
still
of
skeptical?
some
they're
of that's
feeling
fading.
better about it.
Yeah, it's fading because they see you smile.
Right.
Your energy is, as you were telling me, your energy is up.
Yes.
Mhm.
Yeah, big energy improvement. And the number of trips to the bathroom is greatly decreased.
Oh yes.
Greatly decreased. So we're at right now, between 40 and 45 times trips to the bathroom in 24 hours prior to coming to me. And now, after 3 unique protocols that she was able to do at home, and it was not an overnight success in the sense of just, she came to me and the next day she was better, or the next month she was better. We had to go through a pretty grueling period of time of helping her get through cleaning up the different infections and toxins hidden in her tissues of the brain and other parts of the body, which I'm going to make another video right after this. You're going to see me make a nice report about the different kinds of hidden disease-causing infections and toxins I was able to detect in different tissues of her body and help her body safely eliminate these different infections and toxins so that she is feeling better now. So 40 to 45 times in a 24-hour period, you're now between
I'd say 15 in the 24-hour period.
15 and
maybe,
24 hours.
maybe 15 to 18.
15 to 18 in 24 hour period. So she's about a third of the amount of time that she has to go to the bathroom now as opposed to what it was before. And you just told me when you came here you slept, what did you say last night?
Last night I was like 3 times up, but Saturday night I just got up once. And
One
it's
time.
been years since I've been able to just get up once.
Yeah. Years.
So I feel better because I'm getting more rest at night.
Sure. And more
Yeah.
energy.
Mhm.
And the smile is there.
Yeah,
You
he
got
says
a
it.
And in the exam today, which took us about an hour to do, you did not even have the urge to get up one time.
No. Usually I have to, but I didn't this time.
And she's had to get up
That's great.
2, 3, 4 times the first visit with me.
Mhm.
I don't remember, I should have written it down, but we're talking multiple times. Even a
Mhm.
dentist, we had to go, which I'll report in the next video, but even the dentist office I sent you to, because we had some infections and things in the mouth we had to clean up, which I'll talk about in
Mhm.
the next video, but the dentist office reported to me when you left there that incredibly frequent.
Yes, it was.
It was like every 20 minutes running to the bathroom when you were in that dental chair. And you were there for 5 hours for the first procedure, and it was constantly getting up to go to the bathroom.
Yes, it was.
You won't have to do that anymore. We're almost
That's
done.
great.
We're almost done. So right now, this is an interim. This is not the full recovery, but we're getting there. And this is sustained improvement. And again, there's a bumpy road along the way, but this is sustained improvement. Decrease in the urgency, decrease in the frequency. We still have other infections and toxins to clean up in your tissues. You'll hear me talk about this fourth examination today in this next video. That'll be merging in a few minutes. But just understand, when we can actually pinpoint and safely remove the hidden infections in parts of your brain, your spinal cord, your brainstem, the spinal fluid, the kidneys, the intestines, which are aggravating and upsetting the bladder function and bladder symptoms that you're dealing with, when we can get rid of those hidden causes that you're not going to find with a bladder insufflation, or cystoscopy, or Botox, whatever they're doing out there that's not working. And in 1998, over 200 million people worldwide had bladder control disorders, and it's not even better now in today's time with all of the wonderful technology that these so-called specialists have at their disposal to be able to try to figure out the bladder control problem. We've got to have a more expanded mind to understand the way the nervous system and the bladder are connected. And because your brain can have some kind of infection or toxin that's offsetting brain function that makes the bladder feel like it's going to spasm, or bladder feel like it's full, but it's not really the bladder that's the problem. It's the part of the brain that controls the bladder function, and we'll talk about that more in the next video. So right now we're seeing great improvement. She's still not 100% yet, but there's great improvement, and I really appreciate you both for getting on this video with me to help all the ill people out there who are suffering. And your suffering was... I just remember the first day I met you. I'll leave it with this until we see you next time. But your suffering was so horrible because there was no smile.
Yes, it was.
And your suffering was.
Yes,
if you can just let people know, if you can just say how really bad. Knowing going to the bathroom 40, 45 times in 24 hours might not be enough for them to really feel or understand where you're coming from. But how bad was it for both of you? What was it? Were you able to go to restaurants? Were you able to go shopping for food, go to a movie theater?
It controlled our life.
Controlled your life.
And it was not only just the bathroom trips, but she would tell me how painful it was. So, I mean, it was agonizing. More than just the aggravation of her having to go to the bathroom. We would have to figure out, if we went very far on a trip, we'd have to try to guess at where the bathrooms were so we could stop. We couldn't make it all the way. So it really changed things.
We're getting our life back.
Yeah. Excellent. Good smile. I love it. I love to see the smile. Real people, real results, real life-changing experience. I believe I can help it get the job done for you too. Don't expect an overnight success, but do expect to get better. And I expect you, like I have expected for her to get better. And she came in after her first protocol, I'll tell you, a couple of months later, and the next one, and even after some dental surgeries that had to get done. And she was not happy. She was still suffering. It was like nothing was, we were getting nowhere. It seemed like, right, in the first 4 or 5 months, it seemed like you were getting nowhere. Right? There was like a little bit of you had like one day of, oh my God, I didn't have to go to the bathroom last night. And then it came right back full force. And so it wasn't just one protocol or two. We had to get through the mud and come out of it. And now you're really seeing sustained improvement, which is awesome. Yes, awesome. Thank you. I really appreciate you both. And these people watching are really going to appreciate you when they see this. And we will be coming up with another video when she really is out of all the mud, so to speak, of this whole condition. With sustained period of time, we're going to come back, and they're grateful enough of getting better and believing in this system that I practice to be able to show us another video, where we're done with this whole puzzle. Okay? So thank you for both.
Thank you so much.
Appreciate you. Now, isn't that just awesome? Isn't that incredible? She suffered for years. Years. They both did. Suffered for years with this overactive bladder, painful interstitial cystitis condition, and she was not able to sleep through the night. She was not able to go to restaurants. She was not able to go and be with friends. Barely able to leave the house. They were always looking for bathrooms wherever they went. Even if they were driving a bit long distance, they had to know. Along the way, they had to chart their course to know where the bathroom's going to be,
How long can we get from point A to point B to point C? How much time do we have before she's going to have the bladder urgency to have to go to the bathroom again? Whether something released from her bladder or something didn't release from her bladder. Again, I'm Dr. Lonnie Herman, and I'm here to share with you we're going to do this video in a few parts. Number one, we're going to talk about, again, her symptoms prior to starting with me. And then we're going to go into the protocols that I developed from her in this unique examination process that I perform in my clinic. And again, she did do these protocols at home, and there was no stress on her to be able to have to come into my clinic every week, every day, or even every month. So now we're seeing that we are coming along in a very incredible position of so much relief from this horrible stress that she dealt with for several years. We're talking about 8 years, somewhere give or take a few months, in 8 years of her life, their lives. And her husband was pretty exhausted as well when I first met them both, because he could not sleep. He could not sleep through the night because she was constantly in pain and having to go to the bathroom throughout the night. Her symptoms were, before we started, number one, she had burning and itching always. She goes to the bathroom and she gets done in the bathroom and she felt like she went to the bathroom and she would get done and she felt like she had to just go right back to the bathroom again. It felt like every hour she feels like she has to pee, and there were times that she had to pee and there was nothing coming out. So, and again, her symptoms were, it was before we started this care, 40 plus times in a 24-hour period to go to the bathroom. And now she's about somewhere between 12 and 18 times to go to the bathroom in a 24-hour period, which is incredible. Her energy is much higher. The pain that she had in her temples, which was a constant problem for at least 10 years, they told me, that was at a level of 6 when the severity from 0 to 10, if 10 is the worst severity, she was at a 6, constant for more than 10 years, and that is gone, 100% gone now. Okay. So these protocols are based on a very unique system that I practice here. I've expanded on multiple different practices, multiple different studies that I've done in the past 11 years of postgraduate research in my life. And if from a neurology postgraduate study program to neurochemistry to immunology to biochemistry and endocrinology and blood chemistry analysis and gastrointestinal disorders and thyroid disease conditions, studies, and further, very deep, very detailed, very involved and passionate about dental work and the connection from dental conditions, infections and toxins, hidden infections and toxins in the teeth that most dentists are missing when they do a dental evaluation. So we're going to discuss that as well, of what I found with her mouth that was connected to her bladder disorder, and her fatigue, and her temple pain, and ulcers that were appearing in the mouth. And just understanding in a very different manner, let's put all of this together, cardiovascular research, let's put all of this together into even lymphatic system research, and let's put all of this together into a unique, well-rounded system where we can actually pretty much take a peek into your tissues and find what kind of infections and toxins are in which tissues that are causing the body to malfunction. So her first protocol with me was May of 2018. Right now I'm filming this video, it's January 22nd, 2019. And in two parts of her first examination, we did a very a unique exam process, which I perform every day in my clinic, which was able to help us determine which kinds of infections and toxins were in specific tissues in her body, in her brain. And I'm going to help you understand about brain tissue and how it's connected to a bladder disorder. And furthermore, I did a very unique dental examination on her. And I filled out a specific dental chart and sent her over to a dentist who I work with for my clinic, for my patients here in South Florida right now is where I'm located. And we had to have some serious dental revision procedures done, because without getting the dental revision done, there was probably no way that she'd have this amount of relief from her condition. Before I even start, I'm going to cite one bit of research that I found, or statistics about overactive bladder, bladder control disorders, including incontinence, overactive bladder, and interstitial cystitis. In the year 1998, the World Health Organization, the statistics that they discovered around the whole world, there were over 200 million people around the world suffering from overactive bladder, painful bladder disorder, incontinence disorder. In the past, right now, 21 years, there has been no improvement in the kind of care, in the type of studies to treat the bladder disorder in a person. Whether it's a youngster or a middle-aged or an elderly person, people are suffering with their bladder disorders. It's the statistics, which I have not found, but I'm just assuming since the world population has grown more now than what it was back in 1998, that the statistics are probably even worse. Well, I'm here to help make a difference. And here is one real case study, real person of several that I'm putting up on my YouTube channel. There are some real people who are getting better with this unique work with a very in-depth understanding about the nervous system and the relation to the bladder control and kidney function as well. And before I even share these now 4 protocols, 3 before you saw the video, and now the 4th one that I discovered when I just examined her, is that when you go to a urologist or a kidney specialist or an internist for your bladder disorder, even a general practitioner for a bladder disorder, let's go with the example of a urologist, when that urologist doesn't understand the connection of the nervous system to the bladder, that physician is most likely not going to be able to provide you an effective strategy to help you get well. To get well, not to medicate it, not to cover it up, not to try to keep it at bay and you're told that you just have to live with it the rest of your life, to literally help yourself fix yourself. So they've got to understand multiple systems in the body, how the nervous system and the urinary system work together, how the cardiovascular system and the urinary system work together, how the endocrine system, which part of it's in your nervous system in the brain, and your urinary system work together, how the lymphatic system, it's all connected, the gastrointestinal system, it's all connected, how your dental condition, it's all connected. We've got to understand it all. In her first examination, when she was a bit weak from years of suffering, she was a bit weak, so we had to start out slow with this. Aggressive to being able to help her be able to start clean up her tissues and start to make changes in her body. And it did take us some time to clear up multiple systems to be able to see and have her experience these amazing changes that she's experiencing so far in this unique care program that I offer for these overactive bladder and interstitial cystitis conditions. We had to start a bit slow, could not be too aggressive, even though we were being, if you will, aggressive to start cleaning out or helping her clean out the body. Because also, in addition to her weakness, her whole body weakness, we had to really clean up what was in her jaw. She had been through cancer treatment twice in her life. There was chemo, there was radiation, there were surgeries, and one thing that occurred, and she had in her teeth, which I'll talk about in just a few minutes, with the chemo, what can happen is it can actually cause more weakening of the nervous system and the immune system and gastrointestinal and so on. So we had to pay attention to that factor as well in this program for her. She had several teeth in her mouth, 3 of which were root canals that were infected. They're always infected. And if you don't know enough about root canals and you have one or more than one root canal, you should look up some information on the internet. You can type in these 4 words, dangers of root canals. Dangers of root canals. You can even look up a great video that some dentists put together called Root Cause. You can look that up. It's probably on YouTube. I believe I even saw it on Netflix. So get some more information about these root canals. The root canals are dead and they're infected. Dead, infected. You leave a dead tooth in the mouth, it's only changing the function of the whole body, number 1. Number 2, the tooth is infected and you're allowing the infections in the root canal to continuously reproduce themselves and they get into the saliva. And where does your saliva eventually go? When you swallow liquids, they're going to go to your kidney, they're going to go to your bladder. So when you've got infection, just from that perspective, going from the teeth down to the bladder, you're going to have chronic bladder conditions from the root canals in your mouth. That's part of the puzzle that we had to deal with for her. She had 3 root canals that we had to get extracted. She also had a crown, and underneath the crown there was infection, and that we had to deal with that was not seen on a regular dental x-ray or even a CT scan. I discovered it with a very unique dental examination that I perform in my clinic for many patients who come to my clinic for this unique work I'm offering. And I was able to discover that the tooth had a problem, an infection underneath a crown that had been there for more than a decade in her mouth. And further, she had several teeth in her mouth that had these dental amalgam or mercury fillings in her teeth, and those were also poisoning her tissues. If you don't believe that the silver-colored or mercury dental amalgam fillings in your teeth are causing you a problem, or your dentist doesn't want to believe or believes that they're fine and they're not causing you any part of your chronic disorder with your bladder or any other symptoms in your body, you deserve to know the other research and speak to other dentists who do believe in this and other practitioners who do understand that the metals in the teeth are only causing problems in the body. It is not safe for a dentist to touch that mercury filling before they put it in your mouth. It is not safe to have mercury sitting in your hands. It's not safe to have mercury sitting on your skin because it's poison to the tissue. If you broke a thermometer by accident where the mercury came out, it's biohazardous. So why is it okay to put that kind of metal in your teeth, and then it's okay for you? But when the dentist takes it out of your teeth, you know what they do? They won't give it to you. You know what they're going to do? As a trophy that you took it out of your mouth, you know what they're going to do? They're going to tell you they can't give it to you. They're going to have to put it into a biohazardous container, and they can't even throw it away in the regular garbage because it's biohazardous. It has to be, they have to remove it from their practice. There's a special kind of garbage collection system that's going to come to their clinic and pick up a biohazardous material. Why is it okay to have that biohazardous material in your teeth where you're breathing it in and you're swallowing this invisible to the naked eye, invisible toxic mercury vapor? And I'll put up some videos here right next to me. I'm going to show you some images that I'll show you on a YouTube screen search, a YouTube search of these different videos. Then you deserve to take the time. It is your obligation to help you fix yourself. You've got to know about the metals in the mouth. So watch these other videos that you'll see me show the links up here next to me, okay? Furthermore, we've got to have the right kind of dentist to take out the mercury from the teeth, because you don't. And I'm going to show you right now a brief part of a video that I found from another dentist who did a great video production about what happens in the air around your face and in the dental, the room. So what the dentist, the dental hygienist, or the dentist assistant, as well as you or anybody else sitting in that room when they're drilling that mercury out of the teeth, that metal out of the teeth, just the cloud of invisible to the naked eye toxic vapor that's coming out in the air that you're breathing in. So you want to get it done right. So you'll see me showing this video right now here. So she had to get, back to Miss Mathis here, Mrs. Mathis, excuse me, she had to get their teeth handled, and that was immediate. We wanted, and she wanted, to get as quick of a recovery as possible, and that's what I'm hoping for as well. I expect her to get better. I expect you to be able to get better. But she had to be able to get a quick recovery as possible, so I demanded that she was getting the dental revision done as soon as possible. I will tell you, it was pretty traumatic in her first. Before we get into all these protocols, we had to understand this for her. She had a 5-hour dental procedure to pull one of those infected root canals because the chemo, what I understand what the dentist told me, is the chemo that she had done in her past, the chemo had actually caused the bone, the jawbone, and the tooth to fuse and become one. 5 hours to take out this tooth. 5 hours. Getting the tooth out did not make a difference in her symptoms. There was no physical change that she could feel. Even with the other 2 root canals that we had to get extracted, there was no physical change she could tell right away. So the point that I'm making is there are strategies that we have to get done for you, and I've got to be able to understand you when I do my first consultation and investigation appointment with you before the first unique examination. And there may be several exams that we have to do over a period of time. Maybe this will take you a year to clear this up. Maybe it will take you 2 years. Maybe it will take you 3 months. I don't know. I wish the best, quickest, fastest recovery for you. I expect you to get better, but I can't tell you. There's no way to predict how quick the recovery is. Just know the recovery can happen. Okay? And again, you're going to see future video from these 2 lovely people who are generous enough to share her recovery process, her experience, what's changing for her and them in their lives. So So the teeth were part of it. I'll talk about those teeth again in just a few minutes. Her first protocol from May of 2018. I found a tissue with her that was really stressed in her brain, which controls the kidney function, by the way, called the hypothalamus. The hypothalamus is in the brain. The hypothalamus is the chief conductor of your entire endocrine system. One of the many hormones that the hypothalamus makes is ADH, or antidiuretic hormone. Antidiuretic hormone is a hormone which tells your kidney when to not release urine to the bladder, or when to release urine to the bladder. So the hypothalamus of the brain produces this hormone, delivers it to a part of your pituitary gland in your brain. The hypothalamus can measure many things, one of which is blood pressure. The hypothalamus, when it measures the blood pressure in the brain, without getting too technical, I'm not here to make you into a physician, I just want you to understand a bit more, because when you're better informed as a person looking for answers, you can understand what you're missing with the care that you're getting, and you can understand better what you've got to ask and what you've got to really go after, and who the right person is to help you. Or let's just say, let me just say, who is most likely able to help you help yourself get better. Maybe that's a better way to put it. So the hypothalamus creates this antidiuretic or anti-urination hormone. It delivers it to the pituitary, and the pituitary waits. And it's holding this hormone, waiting for the hypothalamus to feel when the blood pressure is shifting away from normal in the brain, and it will tell that pituitary gland to release or when not to release that hormone to the kidneys. The kidneys don't know how to work. They don't know how to work without being told by this particular part of the brain. The kidneys are told when to hold on to the urine and when to release the urine. Without getting deeper into blood pressure right now, but understand the kidneys are told what to do. So there are times that people have overactive bladder because the bladder is constantly filling with fluid. There are people who have overactive bladder symptoms where the bladder is not even filled with fluid, but people feel like it's filled with fluid. So the bladder can be in spasm as if it's filled with fluid, yet it's not, because there are changes in the reflex system in another part of the brain, or brain stem, which I'll get to a little bit later. Like, when I'm reporting this, you can pause it, take notes, rewind it, listen again. Okay? So I'm going to give you a lot of information here, a lot of which you probably have not heard before, unless you've watched some of my other videos about overactive bladder and interstitial cystitis. Now, the hypothalamus was infected by a root canal. I found that canal was infecting the hypothalamus. I made remedies to help get that root canal effect of the dead energy of that dead tooth and the infections that were in that first tooth that we got pulled from her mouth out of that hypothalamus. I also found, because she was on so many antibiotics for a very long time, as she said, with no positive changes, or very short-lived, one day of a change and then back to the same miserable situation. Macrobid antibiotic affecting her hypothalamus. Z-Pak or azithromycin affecting her hypothalamus, cephalexin antibiotic affecting her hypothalamus, ceftonir antibiotic affecting her hypothalamus, Cipro affecting her hypothalamus, amoxicillin antibiotic affecting her hypothalamus, Avelox causing stress, literally residues of these antibiotics in her hypothalamus, and tetracycline residues affecting her hypothalamus. We had to clear those out. Remedies were made for each one of those. I also found that the propofol, the anesthetic from surgeries that she's had in the past, was also affecting her hypothalamus. We had to clean that out. When an anesthetic remains in part of the brain tissue, how's that brain tissue going to function normal? Even when you're up and walking around. Even if it was just a tiny, tiny, tiny amount of the anesthetic is left over in part of the brain, that brain is not going to work normal. It can't control your bladder normally, the way you expect, the way you hope, the way it was when you were a kid, if your bladder control problem didn't start when you were a child, per se. And there are some children who do have bladder problems. I also found that Versed, aka, or also known as midazolam, the sedative from surgical procedures in her past, the sedative was also in this hypothalamus, sedating the tissue. I found Candida tropicalis fungus affecting her hypothalamus. I found several bacteria affecting her hypothalamus. I also found the chemicals that are found in the fluid of one of the popular soft drinks. I won't name the name, I'm not here to slander them, but one of the most popular soft drinks on the planet, I found residues of the chemicals from that soft drink also had been absorbed into this tissue, stressing the tissue, and we had to clear that out. And if you can't understand that you are what you eat, if you're not going to understand you are what you eat, if you can't even let me use an analogy. If you took a white t-shirt and you put that t-shirt in water and the water had a blue dye, leave it in there for 10 seconds, take that white t-shirt out of that water, and it's going to be blue. Let it sit and dry in the hot sun for all day, 2 days in the sun. Wear it, sweat in it, wash it. It comes out of without bleach, use a regular detergent or just water. When you take it out of the dryer, it's still going to be blue. Maybe it faded a little bit, but it's still going to be blue. Okay? So we absorb chemicals, they stay in us. You don't know if you're drinking a soft drink, what kind of chemicals they have actually put in there for the coloring and the flavoring, number one. Number two, you don't know where the water is that they're using. Where's the water coming from? Is there any lead in that water? Is there any mercury in the water? Were there any pesticides that somehow got in? Any iron? Something that got into that water that they used to make that drink? Can it be part of your tissues and it's harming you? I also found, when I combined certain parts of a nervous system examination with her, that her corpus callosum, I'll show you an image here, a nice beautiful color image of the corpus callosum tissue in the brain. The corpus callosum is over 250 million nerve fibers and allows different parts of the brain to communicate with one another. So without getting deeper into that and to turn you into a neurologist here, the corpus callosum needs to be clean and needs to be functioning normally to allow brain to communicate with other parts of the brain and to communicate with the body. There's many sensory and motor nerves that are part of this tissue known as the corpus callosum. She had the sedative Versed, also known as midazolam, causing that sedation of that tissue, causing her body to not work well. She came back to me after this first protocol when I saw her in July, 2 months later, and she was still suffering with her symptoms. She said she didn't feel much change, but she was still hoping, she was still praying. They were still, her husband, they're determined, they believed in what I was presenting. It was the only thing that finally made sense to them after all the doctors who were supposed to be the specialists in her condition. They didn't help her. They said, we are going to give this, we're dedicated. We're stressed, we believe in you, we hope it's going to work. Okay? So the next exam, and she had to get those teeth handled at this time, but the mercury came out at this time from her teeth in July. And the other root canals came out of her mouth, and this time in July by the dentist I sent them to. When she came back into my clinic in July of 2018, I found, when I did, again, a very unique kind of examination, again, I've expanded on multiple systems and brought them all together to be able to get a really good, thorough understanding of what's going on in the body and provide people relief from their conditions, chronic illnesses. And watch other videos that I put on my YouTube channel. I think you'll be pretty amazed at some of these incredible results that we're getting, improvement of people's function, decrease of symptoms that they suffered for months or decades. In her second exam, her reticular formation, which is a tissue within your brainstem, I'll show a picture here. The reticular formation is a tissue in the brainstem which helps sensory and motor from brain to body and body to brain. And there are circuits that come out of this, nerve tissue that comes out of this reticular formation, which goes directly to the bladder. And we have a micturition center, also known as, I'll call it, the only name that I gave it is a urine reflex center. So when the bladder can go into spasm, it can actually go and have nothing in it, and it feels like your bladder's full, like you got to run to the bathroom. You're urgent, you got to go again, but nothing comes out when you sit down, or maybe just a drop comes out, but it felt like it was really full. And this can happen in men and women. And men, it's not always a swollen prostate that's causing it. You might have a bladder spasm that feels like you're full, and they say your prostate's fine, yet the bladder can go into spasm because this part of the brain stem in particular, can actually have infections and toxins in it, which is causing the bladder to act abnormally and feel like the bladder's full when it's not. I found in her reticular formation, she had a virus, the St. Louis encephalitis virus. I'm going to name a few here. She had the St. Louis encephalitis virus, dengue fever virus, mosquito bites can cause this, and the influenza virus affecting this delicate, sensitive tissue in her brainstem. I'll tell you, very interesting, Bill Gates, Microsoft, you know him, he put up a tweet on his Twitter account several months ago, and it was a simple statement: I hate mosquitoes. And from his travels around the world, he said that there were more serious illness and debilitating and sometimes death caused by mosquito bites from the infections that they're transmitting to humans. And it doesn't have to be a Zika virus or Ebola virus like in another country. It can happen in the U.S. and anywhere around the world. Getting bitten by a mosquito that gave you a parasite, a bacteria, a virus. It can happen. So I'm going to run through a list here of different tissues. Again, not to make you into a doctor, but you deserve to understand the complexity of my system that I'm doing here, of my examination skills and knowledge, but also what we have to do to unravel your individual condition. I found that her upper brainstem, also known as midbrain, where there's a particular tissue in this part of the brain, I'll give you the name, you don't have to memorize this, called a red nucleus. There is motor control to body parts, including the bladder, that come out of this particular tissue in the brainstem. She had the dengue fever virus. She had the West Nile virus in there. She had the yellow fever virus. She had Lyme infection. And she also had mercury from the teeth in that midbrain, also known as upper brainstem. Remedies were provided to help clear those out safely and effectively. I found the metal from her crown of her tooth, the crown that was removed, those metals, which actually had some mercury and there was gold in her brain, stressing the brain. I do a very unique bioresonance system, again, combining many different practices into one system. But with this bioresonance system, there's no computer. It is all manual, hands-on. There's no device that you're going to be printing out some kind of computer printout about this. This is all a very detailed, integrated, it's about a 2.5 hour visit with examination in my clinic. I found these different metals from the tooth affecting her brain, stressing the brain, causing her brain not to be able to function appropriately, which caused the bladder to not function appropriately, caused temple pain, caused a number of things, fatigue with her. I found that her cerebrospinal fluid, the fluid around and throughout the entire central nervous system, she had the dengue fever virus. I found in a part of the brainstem, which is also where that reticular formation, which I just talked about a few minutes ago, this part of the brainstem called the pons, P-O-N-S, where the micturition center is located, or the urine reflex center, as I call it, is located. She had Lyme infection in there, and she had dental mercury in there, causing it to malfunction. The bladder can go into spasm because the part of the brain and brainstem which control the bladder function, that part of the brain is stressed, it can make the bladder stressed. And let me give you a simple analogy. If you've ever seen a person after they had a stroke and their arm is in spasm, it's not the arm that's the problem that made the muscles so tight here. It's because the part of the brain was stressed, died from a stroke, that can actually cause that muscle to stay in spasm. And that muscle is hurting and the muscle is cramping. But it's not because the muscle here is a problem in exercising the arm. It's the brain that has to be tested and effectively, some effective strategy to help reduce the stress in that part of the brain or enhance the function of that part of the brain so we can get some muscle relaxation in that limb. Understand that when the brainstem is stressed, it can make the bladder feel like you've got to go pee even though you don't. Even though, I know you're running to the bathroom, but I'm saying even though nothing comes out when you go to the bathroom. I found, because she also had burning during urination, I found in her urethra, which was not found in the exams that they did in the doctors that she went to. I found the metals from the crown. I found a group B streptococcus bacteria. And I found another parasite known as cryptosporidium. I found the dengue fever virus in her urethra. And I found another streptococcus bacteria known as Streptococcus aureus affecting her urethra. I also found in the renal pelvis, which are tissues, I'll show you a picture here next to me. It's a tissue, it's like a funnel that's coming out of the kidney to be able to siphon the fluid to go down the ureter, which goes down to the bladder for you to go to the bathroom. She had Streptococcus aureus in that renal pelvis, and she had the dengue fever virus in the renal pelvis. Those are all cleaned up with remedies. I found in another part of the brainstem, which also helps to work parts of the body, this is called the medulla, the lowest part of the brainstem, which is directly above the spinal cord. I found the dengue fever virus as well. In the meninge layers, especially the pia mater layer of the meninges, which is it's a tissue, a thin layer of tissue that's deeply invested into the brain through nerves and blood vessels, and it goes into the folds of the brain and into the spinal cord. And when that's stressed by infection, and it doesn't have to be a meningitis where you're in a hospital going paralyzed or going blind and having antibiotics for weeks in the hospital. You can actually have a subtle infection that's causing irritation to the nervous system that can cause your bladder to be irritated. I found the dental mercury affecting her pia layer of her meninges, dengue fever virus, influenza virus, and the same parasite Blastocystis hominis affecting that pia layer of meninges. In another layer of her meninges in this July 2018 exam, I found in the dura layer of the meninges, I found the influenza virus. She came back to me in October. She had a little bit of a break but nothing major, nothing great to report, no long sustained relief of her symptoms. She did say that at nighttime it started to decrease a bit. She wasn't able to go 10 times at night, or sometimes sometimes really horrible nights. There was sometimes even every 20, 30 minutes she was going to the bathroom, even that way in the daytime. So there was a slight decrease, nothing incredible, no major incredible change at this point after 2 protocols. They still were dedicated. It still made sense to them. They still understood the complexity of the condition and kept educating them. And in this next examination, but I'll tell you that she did say that she noticed the pressure in the temples, that soreness there, not pressure, but soreness, just a notch down it came, just a notch. She noticed that the ulcers in the mouth, just a slight decrease in the amount of ulcerative condition in the inside the cheeks and the gums here. But she also did have a slight decrease in the frequency at night. No major report at that time, but they were still dedicated. They still believed, and they said, we're going to go with this, everything we've got, because she's got to get better. And they're sweethearts since, I think it's like elementary and middle school. It's just so sweet. So now, and she was not, let me tell you, when she was on the table in the exam room, the first, second, and third visit, she was getting up off my exam table to go to the bathroom, sometimes every 20 minutes, or even less, or just a little more than 20 minutes. When she was in the dental office, she had to get out of the dental chair through the first 5-hour surgery to get the tooth out of her mouth, the first root canal that had to be removed. She was getting up. They told me in the dental office, it was between 10 and 20 minutes. I have to go to the bathroom again. I have to go to the bathroom again. I have to go to the bathroom again. She could not be settled in the chair. She was so frustrated. She was so exhausted. He was tired. She was so exhausted. There was never a smile. It was just, I hope, Dr. Herman, I hope you can help me get better. October 2018, she came in. This next exam, before what you just saw, which is the protocol she followed, before what you just saw as the, now we're really coming out of this horrible 8-year condition. Her glial cells, which are cells within the central nervous system of every human, these cells repair central nervous system tissue and reproduce the myelin. She had root canal infections on her glial cells from 3 of those root canals that came out of her mouth. All 3 of those had been infecting. The infections from the teeth had been metastasizing or spreading to these glial cells, which are all throughout the central nervous system. We had to clean those out of there. Getting the root canal out of the mouth is not going to clean out the infection. It may cut off the source of the infection that went in from the mouth to the body, but it's not going to clean the infections out of the tissues of the body, of the brain, and so on. She used to eat, years ago, McDonald's cheeseburgers. I found the McDonald's cheeseburger chemicals, these chemicals that are not real food, in her glial cells affecting that nervous system. I also found that the root canal, all 3 of those were infecting the left kidney. They were also, the crown, also affecting the left kidney. The cheeseburger chemicals were also damaging her left kidney, stressing the kidney. She had a parasite that's found in the malarial disease, also from mosquito bite, also damaging her left kidney. She had the polio virus inside and damaging and stressing her renal pelvis tissue. I found the root canal infections in the renal pelvis. Her ureters were affected by the polio virus and the parasite from the malarial infection. The meninges were affected by her root canal infections, and influenza virus was also in the spinal cord, and the polio virus was in the pons of her brainstem. Remedies were provided for all of those exam findings that I just reported to you in this, from this exam in her protocol. She followed those from October 2018, came back to me January 22nd, 2019, and now they come in smiling. And now they're reporting, and she's smiling. Her husband said, I've noticed things with my wife that she doesn't realize I'm noticing. I know her for all these years. She's smiling now. She has more energy now. She's not suffering as bad now. And we can go to a restaurant and not have to rush and see where the bathroom is. She actually sat at my exam table. The exam took a little bit more than an hour. She did not have the urge to go to the bathroom one time. Not even once. She didn't even feel it. I said, you're not getting up at the end of the exam, at the end of a little more than an hour. I said, you haven't even made a peep that you have to go to the bathroom. She smiles, she laughs, she goes, I know, isn't it incredible? Isn't it incredible? Awesome. Awesome. She had, in this examination, before you heard this discussion, find and watch through this whole video again and get a deeper understanding. And if you're suffering, before I report the next part, if you're suffering and your family is already at their wits' end with you. Not that they don't love you, but they're already stressed because you've been to doctors, been to hospitals, had all the different tests done that are supposed to be the right medical tests done, and you're not getting relief, and you're watching this video, and you need to speak to them about making the right decision to come here to help me help you, or come to see me to allow me to help you help yourself get better. Have them watch this video. Have them watch other videos on my YouTube channel. I'm going to show at the end of this video, you're going to see thumbnails of other videos of other descriptions that I've given about this terrible overactive bladder and interstitial cystitis condition, and incontinence. And you're going to see other thumbnails again of these other videos, and you can click on those and you can watch them and really get a better appreciation for what's being done here. And I will tell you, there's another video I've got of a female who's got multiple sclerosis, been in a wheelchair for 5 years. She comes to me from Canada. She had such an overactive bladder control problem. When she drank, she had to sit on the toilet for years. The bladder would release fluid immediately. She couldn't be near the bathroom. She had to sit on the toilet. Now, with the multiple sclerosis and the medications that never work for MS, for treating the MS, now she can go for 6 hours with no urgency, with no desire, with no leaking, no diapers, no pads. She has control of her bladder again, and it's been this way with the bladder control for probably about the past 9, maybe 10 months. She has had zero relapse of her bladder control problem. The right kidney in this January exam, the mercury compound that's found in pink sea salt, which she's been using for several years. You can look this up online if you don't want to believe it. If fish can contain mercury, shellfish can contain mercury because humankind, has dumped mercury in the ocean for many years. The salt that comes out of some parts of these oceans around the world have mercury too, stressing the body. Mercury is a toxin to the body. The sea salt, mercury, was in the right kidney. The chemo agents were in the right kidney, stressing your kidney. The mercury from white sea salt was in the right kidney. Aluminum was found in Morton salt, table salt, for decades, up until about 94. Aluminum could be in vaccines that have been taken. Maybe there's even from the ocean. I don't know everywhere it's coming from. Aluminum, stressing the right kidney. She had, right now, when she came in for this, let me pause. She still has some burning from time to time, even without urination, and she still has an itching that's going on in that bladder area. So we found when we did this exam that she still had, and she told me, when I told her what I found in this exam, she said, "That's interesting, because I had that problem when I was a little girl. Do you think it's still from then? Do you think I still have that from then? Because I had the rashes on the skin when I was little, but the rashes went away. And now the infection went somewhere else in the body, causing complications somewhere else." She had the ringworm, which is a fungus, ringworm, in the kidneys, in the renal pelvis in particular. She had ringworm in the pudendal nerve. The pudendal nerve is a nerve that goes through the bladder, around the female reproductive tissue. Ringworm in the pudendal nerve. It goes through the bladder. It goes through various parts of that lower part of the female body. She had the ringworm in the pudendal muscle. Also, she had ringworm in her cervix. She had ringworm in the cortex of the brain. I'm going to different parts of the body for a reason, because I just want to talk about the ringworm right now. She had ringworm in the cortex of the brain. We have motor neurons in the outer part of the brain that help to regulate motor control of body function. She had the ringworm up there affecting its function. She also had, I'll stay up there for a moment, she had Roundup, the weed killer spray, in that cerebral cortex tissue. Let's go back to the kidneys. She had Roundup in the kidneys. She had mercury, more mercury, another kind of mercury in the kidneys. She also had in her urethra, she had parasitic infection and the ringworm infection in the urethra, not found in any study that was done by the medical doctors. And she had in the brainstem still, she has, which is the reflex center, the micturition center in the brainstem. She has the aluminum there as well. And a part of the upper brainstem, which I talked about earlier, which is called the red nucleus. Red nucleus helps to distribute motor function to the body. The red nucleus helps to control the bladder muscle. The bladder is a muscle. It can go into spasm like any other muscle in the body. And when the part of the brain is stressed that controls that bladder, what's going to happen? What's going to happen? The bladder can't function normal. So I found mercury in that red nucleus as well. She's taking remedies for all of these that I just discussed. I will see her again in 75 days. 75 days. She's going to be home doing this protocol. And there may be stressful periods as she's going through this. Sometimes there's aggravations as the body's getting rid of infection. Maybe that ringworm's going to come out of the brain or come out of her kidney or someone, and it's going to come out, or the cervix, and it's going to come out and cause a rash on the skin again. She understands. She understands because the infections are finally being expelled from her body. Sometimes there's aggravations in her true healing process. And that we have to understand. Sometimes it just occurs. You might not be happy, you might not enjoy it, but I've seen enough patients over the past several years of doing this kind of work where sometimes there's aggravations that there can be irritations of these infections on the skin. Irritations on the skin, on the feet, in the vaginal tissue for a woman. A burning that can happen in a man's, genitals when the infection's coming out. It can happen in the brain. I mean, there's many different kinds of aggravations that can occur when you're taking these remedies to help your body finally expel what's caused your condition. Watch these other videos that I put these thumbnails up for here. Share this video with just one friend. There are hundreds of millions of people suffering from the bladder disorder. Hundreds of millions around the world. I see people who come to my clinic from Israel, from Norway, from Netherlands, from Romania, from England, United Kingdom, from many different parts of this world, from Canada. We've seen people from Australia coming into my clinic for this type of work that I offer, from Thailand even, coming to my clinic. I'm here to help you help yourself get well, and it may be a bit of a journey that we have to go to. Not every time is it going to be overnight success. I hope it is. I'd rather it be, because the sooner I can show your improvement with the people of the world, guess what? They can get help too. That's my greed. My greed is to get you better as fast as possible with sustained improvements, help you get yourself better with improvements that are going to come at lightning speed. I want that to happen more than anything. I don't expect it. I expect you to get better. I hope it's going to be fast, because the sooner you're better, the sooner I can share your experience with the rest of the world, because there are too many people suffering with chronic bladder disorder. Okay? So share this video with one friend. Like me on my Facebook page. I put up unique information there, and there's many different posts you can scroll through and read and watch videos. You can follow me on Instagram and Twitter. And subscribe to my YouTube channel. Turn on notifications so that you'll get an email when I do put up new videos here on my YouTube channel. I've got lots of different videos. Go through and look at my playlists on my YouTube channel. You'll see different videos of different topics. Go through and understand more, okay? You can call my clinic at 954-370-3100. That's 954-370-3100. Or you can send an email to my clinic assistant. She'll help you with scheduling an appointment with me. I'm here to tell you right now, unfortunately, regular healthcare insurance, whether it doesn't matter which type of insurance policy it is, it doesn't cover the kind of work that I'm offering. They don't recognize this work. So this is an investment in yourself. It will be out of pocket. My assistant will talk to you about our fees when you call. I'm ready to help you. Call my clinic at 954-370-3100. Look forward to helping you get well too. And do be on the lookout for their follow-up video of her dramatic improvement from where she is already improved from right now. Let's watch another piece of that video of her improvement. I'll see you soon.
Feeling better now. So 40 to 45 times in a 24-hour period, you're now between...
I'd say 15 in the 24-hour period.
15
maybe,
and 24 hours.
Maybe 15 to 18.
15 to 18 in the 24-hour period. So she's about a third of the amount of time that she has to go to the bathroom now as opposed to what it was before. And you just told me when you came here you slept. What did you say last night?
Last night I was like 3 times up, but Saturday night I just got up once. And it's been years since I've been able to just get up once.
Yeah, years.
So I feel better because I'm getting more rest at night.
Sure. And more energy.
Mm-hmm.
And the smile is there.
Yeah.